Nearly 350,000 Americans will get diagnosed with some sort of pancreatic disease this year, but many of us don't even know what the pancreas does.
So today in Your Health with Bellin, Dr. Chris Rupp is here. He is a surgeon specializing in treating gastrointestinal issues, just to talk a little bit about the pancreas, how it works, and why we should keep it in working order. Good morning to you.
Good morning, and thanks for having me.
Let's start with kind of the obvious question. What role does the pancreas play in our body?
Well, the pancreas is actually, it's an organ, but it's also considered a gland. It has a couple functions in maintaining things. One, it helps with digestion. It does secrete a number of enzymes that help with digesting food. And the other big one that everybody knows about is it controls blood sugar regulation, secreting insulin and glucagon. And obviously, if that has a derangement, we develop symptoms of diabetes.
Now, so what are some of the conditions associated with the pancreas?
Yeah, good question. Well, obviously, the most well-known and most publicized one is pancreas cancer. That's a very serious problem. A lot of very notable people have developed pancreas cancer. Most notably, Pat Sajak has been in the news recently. It can be a very deadly problem, very deadly disease, and has a very high mortality if left untreated. And sometimes even if treated, it can be very deadly. The other, probably more common problem that we deal with the pancreas, though, is pancreatitis. And that actually is when someone develops inflammation of the pancreas, irritation of the pancreas for various reasons.
Now, are there different types of pancreatitis?
There are, yes. There's, very simply, we break it down into acute pancreatitis or chronic pancreatitis. There is a hereditary type of pancreatitis that does exist, but that's very rare, very uncommon.
Now, what are some of the symptoms of pancreatitis?
Well, people will oftentimes say after they've had a fatty meal, maybe drank too much on the weekend, they'll develop severe abdominal pain, usually in the upper abdominal region. It can sometimes radiate to a person's back. They can develop nausea and vomiting with this. And they'll feel their heart racing, and they'll develop fevers too with this.
So if somebody notices these symptoms, what's the first step they should take?
Well, if it's a mild form, a lot of people surprisingly just tough it out at home. They really don't have to see a doctor about this. But for a number of them, when the pain becomes so severe that you can't sit appropriately, you can't lie down, can't find a position that's comfortable, you need to seek medical attention. A lot of times that's to the emergency department or your primary care physician if available.
Now, is there anything we can do to prevent pancreatitis?
That's a tough one. Prevention is the most important. Very important lifestyle habits, staying hydrated at all times as much as you can, avoiding tobacco use, cigarette smoking, that is associated with increased risk of pancreatitis. Moderate to no use of alcohol if possible. Alcohol is a very potent stimulant of the pancreas, a very potent irritant, and that can lead to some very serious problems.
A lot of times in Your Health with Bellin, we talk about the importance of having that primary care physician. Is this kind of one of those highlight reasons that they can help guide you in the right direction?
It is, and a lot of the things that we consider, normal everyday management, healthy lifestyle decisions, which physicians can help people with, it really helps to prevent pancreatitis as a nice sequelae of that.
So where can people go to learn more?
Well, Bellin.org has a very good health library that you can look up information on this. The American Association of Pancreatic Cancer, that is another good one. And then some of the more known websites like Mayo Clinic and Cleveland Clinic have very good websites on this too.
Well, we appreciate your time this morning. If you're searching for a doctor, here's the best number to give a call to, 920-445-7373, or visit Bellin.org.